My name is Jim, and I was diagnosed with rheumatoid arthritis in 2012. I had started having problems with not being able to bend my fingers in and out early in the morning and some hip pain. It was difficult to get a diagnosis at first because my C-reactive protein and my RA factor were both low in my blood. When I first started experiencing that, it took about a year until I got my full diagnosis of what it was and was able to begin my medicine. It took about 3 to 4 months before it actually started working, and I had to go through some increases in it and adding some other medicines before it finally helped. Some of those medications wear you down physically, and they also affect your liver and kidneys, so you have to have constant blood tests to make sure that those organs are functioning correctly. My pain level is usually pretty much controlled, but the more I use my hands, the worse it becomes. My pain is usually a burning and throbbing type of pain, and then I have difficulty with bending my fingers whenever it gets to flare. I do a lot of canning and preserving of vegetables. A lot of my canning, I do some peeling the vegetables and preparing them. That bothers my hands, but it's something that I have to do. And I have trouble with tightening and untightening the lids on those jars. The advice I'd give to someone who's newly diagnosed with RA is to follow your doctor's instructions, to form a relationship with them. My doctor talked to me about Vectra DA. He explained that it was a test that would measure several factors in my blood and would be able to show him the disease activity and what level it was at. And he was very positive about it. He uses Vectra DA for almost all of his rheumatoid arthritis patients. I've had the Vectra DA test about 4 times now. You can get a baseline score for the doctor and for yourself, and you can compare future tests to those numbers to see how your treatment's working. It's been very successful in helping us to decrease the level of activity by the next testing. My Vectra DA score the last time surprised me that I was down to a 39 because it was the biggest drop that I've had. I want to continue to be able to go forward and live my life as fully as what I can. I want to be an advocate for others because a lot of people look at a serious disease and they think that that's something that's going to ruin their life or they're not going to be able to continue on, and I want to be a positive role model for people so that they know that you can have a disease and still continue to have a pretty full daily life.